Hello, hello.
We're live.
Sorry for the hold up there. I was running through all the technical things. That's my wheelhouse.
Oh yeah, I do. Right. Everybody knows it.
Yeah.
Yeah, you crush it in the tech sector. Um, okay, well, so it's 4:03, and so I guess what I really have to say about this is hello and welcome to the Evolutionary. My name is David Knox. I'm still your host, and I'm really excited to have Dr. Scott Self on the call today. And welcome to everyone who has joined us. I'm going to go on speaker view on Zoom, and we're going to just jump right into it. How about that?
Yeah. Sounds good to me.
Cool. Why don't you just tell us your story?
Yeah. Yeah.
Give
I'm
us
a
the
native.
give us the one beer version, and then we'll get
All
into
right.
the other stuff.
Yeah.
Oh,
Yeah.
sorry. And by
I'm,
the way, I just wanted to set the expectations for everyone. I've got some questions, some topics that I want to run through with Dr. Scott, and so we'll have kind of a formal interview thing for 30 minutes or so, and then we're going to open it up and have some discussions. So if you guys have questions regarding anything, tee them up. We'll get into Q&A a little bit later. Okay, so go ahead. Sorry.
Perfect. Yeah. Yeah. No, I'm native here from Florida, born and raised here. Left for about 10 years, spent my some time in the military, traveled the world, saw some things, experienced some things. They decided to send me into a little bit more of a specialized type unit where I got some exposure as a combat medic and kind of got my headspace more into the medical realm and decided to go to school. Traditionally trained as a chiropractor, went back for diplomate as an internist, went back for another board certification as an anti-aging healthcare practitioner, and a fellowship in anti-aging metabolic and functional medicine. So it's kind of landed me where I'm at now, and I've keep continuing to learn, more and more and more, so that way I can keep giving more to the patients and changing, making a change. That's my big push on why I want to know as much as I possibly can.
Yeah, thank you for that. Very brief overview of a very full life. I guess the first thing that I would want to know is what is functional medicine? What is functional medicine, and why would one choose it over just traditional Western allopathic healthcare system that we have?
Yeah, yeah, functional medicine, and the thing that I love about it is functional medicine is you get to be a doctor and you get to really use all the skills that you're taught in school, physiology, biochemistry, but then you also get to be the detective. And that brings out my happy inner child because I like to pick things apart and understand. And so I guess to help you understand the difference between the Western allopathic approach and more functional medicine, Western approach is wanting to know what's going on, what's the symptom, what's causing the symptom. My question, and more functional medicine doctors, they're looking at why. Why is this happening? And we want to dig deeper and deeper into understanding the root cause rather than the symptoms. A symptom, you could tell me what your symptoms are. And I'm like, okay, here, this will help you with your symptom, but is it going to come back? Are we really actually addressing what's happening? So it's just a different approach in looking at the biochemistry and looking at the bioavailability of things, just much more in depth.
Right, and we have a better understanding of that than ever before. Of course, that's the way science progresses, right? And I think that probably most people are aware of the fact that our healthcare system has not kept up with the knowledge that we keep uncovering scientifically with respect to metabolism and functional medicine. Would you agree with that?
I agree. I agree. And I think that, there's a standard that is taught and, something simple, say the thyroid. There's multiple markers, blood markers that can be measured with the thyroid, but standard of care is we're going to look at TSH and T4, which are just TSH is a pituitary hormone. It's not really even a thyroid hormone. And then you're looking at T4, the basement form. You're not taking that next step and seeing what the bioavailability is. We have the ability to assess it. And if you have it there, but you're not actively using it, it's not helping you. So it's really, taking that deeper approach and using the technology and the science and as well as the research that's been done now to understand and put the plan in place that's going to help improve the overall effect rather than just here are the symptoms, we're going to give this because that's the standard. Look beyond that. Use your what you've been taught, the biochemistry and the physiology to understand and put the plan in place specifically for that person.
Do you find that the standard diagnostic methodology used in the current medical system is in in a lot of cases are looking at outdated markers or looking at rudimentary uh, measures that aren't really measuring what they think they're like cholesterol comes to mind,
Mhm.
right? It's really basic, and we actually understand a lot more deeply what cholesterol does and what those numbers might mean. And from what I hear, they don't really tell us what we thought that they told us.
Yeah, and that's true. And I think in today, and it is such a standard and it is very rudimentary, like you mentioned, looking at more of a comprehensive panel, even if, say, for example, cholesterol, we see these markers and every doctor's so quick, let's statin, you're above this point, it's statin, without looking at genetics, without looking at a lot of different other factors. And understanding cholesterol now too, and what we have technology wise is understanding that it's not so much just the LDL, because the LDLs or low density lipoproteins, the bad cholesterol, those aren't necessarily the problem. It's those combined with inflammation. That's the combination. That's where the problem is. So inflammation is the root issue there. But even taking the cholesterol and breaking it down, which we have the technology to do, and look at the fractionation of that cholesterol, what does the pattern look like? Based off the pattern and research, we now can identify what your risk values look like for issues from hypercholesterolemia, whether it be atherosclerosis, cardiovascular disease, something along those lines. We have the ability to assess that much earlier in life.
Yeah. And I assume that that is the case with a lot of different of these rudimentary measures.
Yeah. And the thing with the going even beyond that, I mean, functional medicine doctors, we have access to a lot of specialty testing, and it's unfortunate in today's current healthcare system, a lot of these specialized testing or specialty tests that give you a ton of data are not acknowledged as medically necessary. So they're out of pocket
So they're
expenses.
not covered by insurance.
Correct.
Yeah.
Yeah. And so, but it just gives you so much more data. So why would we be looking at basic things when we know that we need to look deeper into what's the cause? Is it our diet? Is it medications? Is it vaccinations? Is it environment? What's causing that? And start to remove that rather than here's your pill.
Right, because that's
Yeah.
our experience in this country for sure, and a lot of countries around the world as we go to the doctor. It's very big pharma driven. They pretty much have, unless we need surgery, which do we really need surgery is another question. But oftentimes what we do is we walk out of there, we have a prescription, and that's the only thing that we have. We have no idea what the root cause was. We don't have any understanding, and we don't have any hope or plan for actually healing that root cause. We just have something to manage symptoms, something that often causes other symptoms.
Correct. Yes. And that's what I see often with a lot of medications. I mean, we're giving medication A that is going to treat this symptom, and it may treat the symptom, but then you have a whole new host of symptoms that occur. And now you're taking medication B to treat the symptoms from medication A. And then you got more and more and more. I mean, I can't tell you how many patients I see come through and they bring, basically a grocery bag or they give me this list of medications that they're taking. I'm like, oh my, well, okay, well, let's start here and see, what's contraindicated and what's counteracting in the system. And beyond that, looking deeper into what is it depleting your body of.
Hmm. Yeah, I'm caretaking for my mother right now in my hometown, and wow, so many meds to treat so many things, and the interaction between those. I mean, if there is a gross interaction between them that is really common and really very detectable, then we'll know about it, or the medical industry will know about it, and they will say, don't take this with that, right? But everyone is different, and a lot of those interactions are going to be subtle. And so, go ahead, get on 8 or 10 different pharmaceuticals and see how you feel. It's not going to be a good thing.
Yes, I agree. And then there's you look at the uniqueness from individual to individual. Your chemistry is different than my chemistry. I've seen brother and sister's chemistry completely different on what they can and can't handle versus hypersensitivity or even reactivity to certain things. I've even seen twins that have had some of the same issues, that you can give them the same exact treatment plan and they both respond completely differently. So it's looking at the unique person. And I think as a functional medicine doctor, that's what we do. We put the patient in the middle, and that's what our focus is. We want to look at that rather than all this other, you know, send you to this therapist and this ologist and this ologist, and you're running around. Look at the full picture. And they teach us in school that 80% of our diagnosis should come from listening to the patient. You get 80% of your diagnosis just by doing a thorough intake and listening. And how can we do that in today's world when a lot of doctors are in and out of the room in 15 minutes?
Oh,
I
yeah.
got a I got a complete history. I'm sure everybody gets it in 15 minutes, right? No way.
Yes,
I
but
mean, I spend the time. I spend about an hour for a patient on their initial examination or their initial assessment with me. I'm spending an hour. I send them a 14-page intake so I can really pick it apart and understand that root cause, putting that patient back in the middle.
yeah, that's great. Thank you for that. So let's talk about this. Someone decides that it's worth it. And by the way, they're going to have to pay out of pocket when they go to a functional medicine doctor because most of what you're doing isn't going to be covered. And I would, we could do a financial analysis of how much they're going to pay actually if they keep going to the Western allopathic medicine doctor. They're probably going to save money in the long run if they actually address the root causes and have a better standard of living. However, let's talk about it. So, what is the process? What's the experience like when they come to you?
Yeah. So, I mean, I always offer a complimentary consultation. So, if somebody is like, I just want to know if we're going to be a good fit. Are you versed in something that I may have? And I have had plenty of rare conditions come across my desk, and I'm just like, okay, that's where again my inner child, the little nerd inside me, likes to be like, okay, I want this. I want to learn more about this, but I know that I can help this person in the safest way possible. Um, but so the process is doing that consultation. If somebody wants that warm and fuzzy, if they're like, nope, I like what he said, I want to go forward, that's when we send you that intake form, that beefy 14-page intake. You take the time to fill it out. I review every single word of that, and I sit and review that with you and get better understanding. So it kind of gets the wheels turning. And at that point, during our discussion, we have another subjective conversation from the patient, understanding a little bit more what their focal points are. So, say for example, a patient's like, "Oh, well, I have some thyroid issues." Okay, well, I'm going to assess your thyroid, but is there something deeper that's stimulating the thyroid? So we may not directly treat the thyroid, but we will be treating the causative agent. So looking at that and assessing where do we want to go with labs? What do we want to assess on those lab values? What are our bioavailable markers that we're wanting to look at well as well? And then from there, the follow-up is let's spend another 30 minutes for me to review your labs line by line. What does this mean to me? What do these markers mean? Education is huge for me, to educate the patients on what do these markers mean, but more importantly, what is the patterning of this marker? What is that indicative of? So should we start prepping for this or preparing for whatever so that it doesn't present itself? It's more prophylactic. We want to catch it before it's a problem. Yeah.
Okay.
And so, reviewing the blood markers and then from there putting whatever plan together is necessary. And the beauty of functional medicine is it can look at some pharmaceuticals and some more nutraceuticals or supplements, if you will. And it can be a hybrid between the two. Medications in the functional medicine world is we're going to give you a specific start and stop date. We don't want you to take a medication forever. If we can treat something in a more natural fashion by stimulating your body through nutrients or through lifestyle or diet, we're going to recommend that first. So that's another key ingredient of the functional medicine practitioners. We want to let your body do what it's designed to do with the least amount of synthetic or external input.
Yeah. And have you had people come in with a whole host of pharmaceuticals that they're on at the moment and actually end up getting them off of many of those?
Yeah, yeah, I do, and that's actually a kind of a happy place for me. I grew up in a very allopathic family, so I kind of have always been exposed to that allopathic world, and I was the rebel. I wanted to do something a little bit, different than my family, and I wanted to, push that. So with that, I don't want to see a bunch of medications, but when I do, and it's starting to work through that, working through either changes in their lifestyle, changes in their diet, working with their some supplementation, and then starting to wean the dose down. I do like to work hand in hand, or at least explain my approach to their primary care or whoever has them on the medications, so they know what my goal and what my plans are. Um, and so that way we can start decreasing it. But as I see the blood chemistry and let the body do the talking, as I see the chemistry coming online, we can start decreasing the dose more and more of the medication and supporting it more in a natural way. During that time, the patient's also learning what their lifestyle should look like through diet, movement, hydration, stress response, mindfulness, those things they're learning. So that way, when the medication's gone, the supplement can be weaned down too, and you can start managing in a more homeostatic place.
Do you find a lot of resistance to lifestyle changes? Because I mean, when we talk about dietary intake, man, that's like a sacred cow for most people, like
Yeah.
like you don't touch that. Like my parents, you ask them to, they have cancer or whatever, that they're like, stand down, do not touch my ice cream. I'm gonna, right? And it is for me too. Like I've made a lot of massive changes, overhauls to my lifestyle, including diets on several occasions. And diet is the one that's the hardest. It's like my body is begging for what it's used to. And until I break that habit and get it used to something else, it's a dogfight. And even afterwards, I've got hypo and hyperglycemia in the family, and I've got a sweet tooth like mad. And so, that sugar thing was a bear to kick. And
Yeah.
and then just, even moving my body more on a daily basis, it's always easier said than done. So do you find people are resistant to that? Or I'm interested in this because people that come to you aren't getting it billed to insurance. And so they have more skin in the game. Do you feel like because of that, they're more like eye to eye on board?
Yes, yes, I do. I do believe that there is a little bit of benefit, because there is skin in the game. And a lot of the times, and it kind of hurts my heart, but then it's also a little bit of a prideful place for me too, that I've heard it from some patients. You're my last hope. I'm coming to you because I've been by this ologist and that ologist, and I haven't gotten any answers. And they're desperate. They're wanting to make a significant change, and they're like, please. And then, just having me go through the intake form with them, and them understanding that we're on the same page, they are like more open to wanting to make a change. So, but with that, it's always slow and steady. I can't say, okay, here's what we got to do. I need you to drink this much water, and this is what your macros should be, and this and this, and that's too much too soon. And so it's a baby step approach. And, even if, okay, well, what's your current level of exercise right now? We're going to bring that up by 25%. What's your diet intake? Okay, eat McDonald's 3 times a day. Okay, we want to cut McDonald's back to just maybe once a day, and let's reassess your blood chemistry. And I always tell the patients the proof is in the pudding. And when we review those labs and we can start seeing those numbers move, now they're okay. I see that making these slight changes, I've made some significant changes here. And it's always about education. Yes, there is resistance, but the more time that you can spend educating and why it's important, and then also taking the bigger look at, if you don't get ahead of it now, you'll be forced to get ahead of it later.
Yeah. How many of those people that come to you have something that has been deemed chronic?
I've had quite a few patients through the years of practice that have come through that this is a chronic issue. This is a chronic disease that you're going to die with this disease or from this disease. And just as a disease is really nothing more than the inflammatory process that has been kind of building over time. So again, all of your disease states come from some inflammatory process or tissue change. So with it being chronic in nature, it's been there for some time. So in order to try to make a change, a lot of doctors like, we're going to suppress it and try and keep things as calm as possible, and,
Right.
and, and stabilize pain, pain, pain. We don't want pain. And that's what we're going to do. So instead of actually looking at it like, okay, well, your liver enzymes are off the charts, and we need to address your liver. And instead, we're just going to watch and wait, and then we're going to treat the symptoms of, whatever's happening with your liver, but we're not going to try to go in and clear it out. We're not going to go in and try and thin out the bile and see if there is a sludge issue, or if there's a thickening of the bile. We're not going to do that. So it's much easier to put it into a chronic category and put in a medication to suppress the symptoms than it is to go in and make the true change. So a lot of times, and I've seen it even with, some of my own patients, that we've changed liver enzymes. I've had liver enzymes that were in the triple digits, which are significantly high. And we've put a plan in place to clear the liver and rebuild and allow the liver to work more efficiently with the gallbladder. And I've done that in 8 weeks, and I've changed their liver enzymes from triple digits to a normal range in 8 weeks. So yeah, I mean, a lot of these things that would be deemed chronic, or you have fatty liver disease. Well, is it? I mean, do you have liver depositions? Maybe, but can you change that? Can you prevent it from going further? Absolutely.
Yeah. Yeah, I feel like a lot of diseases are even if they haven't been deemed scientifically chronic, that they're treated that way, just
Mhm.
because there's no plan to actually heal. Like healing is not part of Western medicine.
Right. Yeah, and that's very scary to me, because this body has the ability to regenerate and the ability to heal itself. It does. We just have to have the right recipe. We have to put the right things in. And I love the philosophy of D.D. Palmer. The things that cause dysfunction in the body: thoughts, traumas, and toxins. If you can look at those three things and say, okay, well, I can understand why I might be having some dysfunction. A lot of people deal with issues with anxiety. Is it anxiety, or do you have an adrenal issue? It's really looking at it maybe from a different set or a different facet.
Right? Because it feels like anxiety. You don't know the difference.
Right.
Yeah.
Exactly.
Obviously a lot of your plan is going to evolve around nutrition. So you want to talk about nutrition a little bit?
Yeah, yeah. Nutrition for me, I mean, and nutrition is important. And the reason why is because your proteins, let's just say simple for a protein. Everybody has heard of a protein. Proteins break down into amino acids. Amino acids are the building blocks of your cells, muscles, and tissue. So if you're not taking in some form of protein, your ability to recover and regenerate, very difficult. I think that in today's society, our diet and our meal plans are everything's supersized, everything. Even things that were medium before, you ask for a medium of anything, now it's the supersized version of everything. So its portions are big, and then the density and the quality of the nutrients is huge too. Assessing nutrients is very important in a functional medicine practice, because you could be taking supplements, or I could be recommending supplements for you. But if you're not absorbing it in the GI tract, meaning that you have irritable bowel, you have any of the GI issues that we hear so much of today, um, if you're not absorbing it, and I'm giving you supplements, you're getting less than 30% of what you're putting in. So it's really just turning into expensive waste. Um, so understanding nutrition, understanding the GI tract and how nutrition is important. And if you don't have a good GI tract, you take supplements from now till the end of time, and you're not going to see the results you want to see. So getting the GI, which is the foundation for me, because everything builds on that. So getting that under control, and then you can allow the nutrients based off of whatever deficiencies you are. And there are specialized testing to truly tell cellular nutrient deficiencies. So if we can identify the cellular nutrient deficiencies, get your GI tract and GI lining that is absorbing those nutrients, now you can have more of an absorption, and you can make the changes that you're looking to make. Um, so yeah, nutrition is big for me. I mean, I there's so many things that I'm very hopeful for some big changes coming soon. With diet and things like that, and our access to food. I think there's a lot of endocrine disruptors and a lot of things that are in our food sources and pesticides and things like that that definitely affects nutrition as well. It's not the same food as our forefathers or our grandparents that were eating from farm to table. It's much different in today's world, and everything's packed full of hormones. So being in functional medicine and understanding the metabolic side of things and seeing young boys, I'm talking teenagers, coming through with estrogen dominance. Like, why is that? I mean, and then you see that there's so many hormones in food. Hmm. It's
Hmm.
interesting. And a lot of women are dealing with more estrogen dominance, and a lot of women are dealing with a lot more breast cancer and ovarian cancers, which is also coming from estrogen dominance. And again, when we look at our food sources and what we're consuming, what are we exposed to on the estrogenic side of things? Is it phytoestrogens, it more plant-based, or is it more coming from, hormones and endocrine disruptors in our food?
Hmm. So when we talk about the GI tract, that is the foundation, which makes sense. And I don't think everyone thinks of it that way. And I certainly don't. I feel I eat a lot. I eat a lot. You see this arm? I eat a lot. Am so skinny. I cannot gain a pound to save my life. And I sometimes think that the issue is that I'm not getting the absorption that I did when I was younger and had a GI tract that was in better health. GI tract, when I think about what little I know about it, is that a couple of the things that we see happening. One is the microbiome, and we take a lot of antibiotics, wipes out our microbiome, is constantly having to try to rebuild itself. And then, we get psychotically focused on antiseptic everything, and now we're not getting that replenishment of stuff into our microbiome. And so, one question is about that is how well do we, how can, how, what are our capabilities for assessing the microbiome? And how well do we understand what it should be? Or is that still kind of a gray area for us scientifically?
Yeah, there again, specialty testing. I mean, like you mentioned, the GI tract very important for the foundation of everything. Going on from there because you can put all the good stuff in if you're not absorbing it. No, no, it doesn't matter. Um, so to assess that, yes, it is important to look at the microbiome, the flora of the GI tract, understanding that, understanding also the inflammatory processes of the foods that you may be putting in that could be causing inflammation. Specialized testing, looking at food sensitivities can give you a better understanding of what you're putting in that may be causing it underlying, not a true full-blown allergy, but an underlying histamine response in the GI tract, which is going to cause inflammation. Inflammation then says, hey, I got to send natural killers that kind of help repair and fight this battle. What's going to happen with the microbiome? What's going to happen with the flora? There's going to be some imbalances. There's going to be an overgrowth. What's the next thing that most people do? I'm going to go get an antibiotic. And the antibiotic then now changes that even more. Not saying that they don't work, because again, I don't hate medications, but I believe that there's a time and place for them. And in an instance, something like that, there's a time and place. Um, so when you're changing that microbiome, that in turn is going to lead to a whole host of follow-up issues. So I always tell patients, you take an antibiotic, you always need to take a prebiotic and a probiotic to kind of, recover from what you've just experienced. Beyond that, you're also dealing with something called xenobiotics, which is all the things that come from our groundwater and filtration systems that, Aunt Mary flushed her Z-Pack or her Keflex down the toilet. Guess what? We all gonna get some Keflex at some point, because it's getting into our sources. So there's xenobiotics, the things that are seeping through our groundwaters, things along those lines that will also play a role in the infiltration of the microbiome. So as for testing, I mentioned that for me, I would usually like to start with a food sensitivity panel to know what you should and should not be putting into your diet. It looks at 96 or more different foods that it's going to look at how your blood and how your body responds to that. In the more the histamine scales, minimal reactivity, moderate, and very severe reactivity. So I would start there by assessing what good foods you may be putting in, but just aren't good for you, assessing that first. And then from there, looking at microbiome. There is a testing now. There's a lab. I'm trying to remember the name of it off the top of my head. There's a lab now that will actually test your stool, your microbiome, the flora, and then from there come up with a specific probiotic regimen for yours, for your microbiome specifically at that given time. Now, could you have exposure to something and that change the microbiome? Sure, but for your baseline, they would give you the specific, bacterial balance for you.
That bacterial profile in the microbiome, as I understand it, there's probably thousands of different microbes in the gut that are beneficial, that should be there, that we want there. Um,
Yes.
do, do but when you go and look at a probiotic, a good one is going to have, a dozen different ones, right? Or one
Right.
or two. And so, are we just, is it, just drops in a bucket of what we actually need?
Yeah, I mean, supplemental forms, I think what they're doing is they're looking at the ones that have the major that have that need the most amount of population. And so they're trying to cover the big hitters, so to speak.
Okay.
And so you when you see that, it's usually the broad spectrum probiotics. Great to have in the system as a maintenance type thing. I always recommend to patients usually every 90 to, up to 180 days, you might want to consider changing it up to a different form. So you're getting some of those other bacteria. I mean, there's simple ones like, even like the that most people aren't aware of. It's called Bifidobacterium infantis. And the only people that have that bacteria are the ones that were breastfed when they were babies. Um, and beyond that too, another one that's often missed on a probiotic side of things is something called Saccharomyces boulardii, which is a really good one to
Vascularity.
look at. Yeah, exactly.
Hmm.
So,
Um, do you ever do you ever suggest a fecal matter transfer? And for those who don't know what a FMT is,
mhm.
it's where you take someone else's poop and you put it into your GI tract,
Yes.
one way or the
So
other.
yeah, I mean, funny enough, it was probably very early on in my practice, and I was practicing functional medicine, and I practiced what I preach, and so the lab reached out to me, and they're inquiring if I would be interested in being a donor, and I was like, wait a second, so that's when I first learned about it,
Okay. Well,
and
that
I was
means you
like,
had pretty good stuff.
I mean, I'm pretty regular, and I work very hard to kind of keep my body pretty stable. But yeah, I see the concept behind it, the research behind it. There has been some good benefits from it. Um, I I I can't say that, I'm 100% for it or against it, really. I mean, I can see the concept behind it if you can get past the idea of what's occurring, and understanding the population of things, and if you can put the appropriate population in with the ability to replicate or repopulate appropriately, I don't see that it would be necessarily a bad thing. I mean, ideally, you know. I haven't considered going down that road, but yeah, I do know I have read some information that it's been benefit. They've seen success with it.
Yeah. I've even seen the idea espoused that you can kind of dial in certain things to change your physiology in certain ways by introducing certain types of bacteria into your population that way.
Yes,
Yeah.
yes, yeah. There
Including
has
including things like how much, what's your ratio of fat to muscle and metabolic rate and other things like that.
yeah. I mean, and that's where the measurements. I'm very interested to see a lot more of the measurements on that and the effects that they can isolate that specific you know marker.
Yeah. I want to open it up for questions in a minute. Got just a couple more things that are on my mind. You mentioned xenobiotics and stuff coming through our water supply. When we can, we carry a water filter because we travel a lot overseas. We carry a life straw water filter with us, and we use that for all of our water. When we come back to the States, we distill our water. Do you suggest that?
I do believe that there's very good benefit there. I mean, I think and knowing that there's changes coming to the water sides of things too. What's allowed and additives and so on and so forth. There's a lot of stuff that is changing along the lines there, but I do believe that distill is good. Um, from what research I've read about purified water, I know that there's a process that goes through as well. Those are two of my primary sources that I would go to.
What is
Distilled is very
purified versus distilled?
so purified. I think it goes through a little bit different of a process, more of a filtering process, versus distilled is coming more from the evaporation
Distilled. Yeah.
aspect. Yeah,
Yeah.
yeah. So there's a process that it goes through, and I believe it's filtered wise. What's in the filter? Is it charcoal? I don't know what they were using really for the filtering, but for the purified side of things, so I guess that's really the only major difference there.
Yeah. Okay. Cool. I could go on and we get into my own stuff
Yeah, we could
but
get into a series
I would
here.
like to open it up and ask anyone on the call if they have any questions. And, folks, if you don't have questions, that's not going to go well for Dr. Scott because I'll keep hammering him with my own stuff. I would love it if someone else would hop in and ask, and you can get as specific as you want. If he can't answer, he'll use those three magic words. I don't know. But
And if I do use those magic words, I do want to get your contact information because, again, I'm that nerd, that inner child that likes to come out that I will research and answer and I will get back to you.